Many women across America today are scared of breastfeeding in public. They have a fear of being scrutinized and jeered at. When in public, they are restricted to breastfeeding in public restrooms and many uncomfortable areas. Women need and should breastfeed whenever possible, even in public. Why? Because it has many benefits for the mother and child. Today I'm going to talk about breastfeeding and economic effects. Both mother and child benefit from breastfeeding, and it's the law. First, breastfeeding has economic effects. Women who breastfeed have saved money because it's inexpensive and available anytime. According to the study by the Agency for Healthcare Research and Quality, estimate that if families follow optimal breastfeeding practices, they can save anywhere between $1,200 and $1,500 a year in formula for the first year. Women who breastfeed lower medical costs. Babies that are breastfed for at least 4 months have a reduced chance or a reduced risk of hospitalization and lower respiratory tract disease in their first year. Second, both mother and child benefit from breastfeeding. Infants benefit from lower health risks. Mothers that breastfeed can also reduce the risk of their children having type 2 diabetes, asthma, and childhood obesity. Mothers benefit from lower health risks as well. Women that have never breastfed have a 27% chance of having ovarian cancer versus somebody that has breastfed for quite some time. And research has also shown that the longer a woman breastfeeds, she has a lower chance of getting cancer of any type. Breastfeeding may lower the risk of postpartum depression, a condition that almost 13% of mothers experience. This disorder poses risks not only to the mother's health, but also the health of the child, particularly when the mother is unable to care for her infant child. And finally, it's the law. Health professionals and public officials promote breastfeeding to improve infant health. According to the American Dietetic Association, human milk is uniquely tailored to meet the nutrition needs of human infants. It has the approximate balance of nutrients provided in easily digestible and bioavailable forms. Women have the right to breastfeed in public in all 50 states, which a lot of women don't realize that's the law. Some states have books geared to protect women who breastfeed in public, excluding them from prosecution under laws that deal with indecent exposure or obscenity. They are protected against any criminal charges for nursing in public. In New York and California, civil statutes address breastfeeding in public and grant women the right to do so. Being denied that opportunity means a woman can sue for her violation of her civil rights. Under current federal law, a woman has the right to breastfeed in public on any federal property in any federal building at any time. In my opinion, I don't think most businesses have a problem with women breastfeeding as long as she's covered up with a blanket, a towel, a shirt, just to cover herself and protect herself, and also to not make others uncomfortable. We have seen the monetary health and lawful benefits of both mother and child when breastfeeding, even in public. Women should should breastfeed at any time in public because it's the law and it's their right.